There are two methods to identify the nerves of the brachial plexus in the interscalene groove. The first method uses the great vessels of the neck as a landmark. This cross-section is as viewed from the head end of the patient. The transducer is placed horizontally across the neck at the level of the cricoid. The orientation marker on the transducer is positioned to the lateral aspect of the neck. The trachea is seen as a hypoechoic structure beneath an arch-like hyperechoic shadow on the right side of the screen. The thyroid gland is seen as a granular structure lateral to the trachea. The transducer is then moved from a medial to lateral location to visualize the brachial plexus. The carotid artery will appear in cross-section as a pulsating round hypoechoic structure. The internal jugular vein will appear triangular in cross-section, either lateral or anterior to the carotid artery. The vein is compressible and becomes prominent on initiating a Valsalva maneuver. The transducer is moved laterally on the neck, maintaining a perpendicular approach to the skin surface. The sternocleidomastoid muscle is thick muscle located anterior to the jugular vein. The muscle will appear thinner as the transducer is moved laterally on the neck. The scalenus anticus is seen lying just posterior to the sternocleidomastoid. The scalenus medius is seen lying behind the scalenus anticus. In cross-section, the neural structures will align as a string of beads behind the scalenus anticus. At the level of the cricoid, the C4-5 and C6-7 nerve roots will be visualized with ultrasound. As the transducer is moved superiorly, the nerve will disappear under the transverse process to enter the intervertebral foramen. As the transducer is moved superiorly, the rim of the transverse process is viewed as a hyperechoic line just below the round hypoechoic neural structure. The second method used to identify the nerves of the brachial plexus begins at the supraclavicular area. Ultrasound is used to identify the subclavian artery. From this location, the transducer is moved superiorly in the neck. The subclavian artery is seen as a pulsatile structure on the right of the screen. The brachial plexus is seen to the left of the subclavian artery on the screen. As the transducer is moved superiorly in the neck, the components of the brachial plexus are identified as a cluster of hypoechoic structures. The transverse process is identified as a hyperechoic crescent underneath the hypoechoic root. As the nerve roots are followed superiorly, they travel deep and disappear into the transverse process.